Okay, so we are going to be talking about advocacy, and this is part of Module 2. So whenever we talk about any sort of concept, we have to first sort of determine what that concept really is. What's the definition? So what is the definition of advocacy? Well, it means to plead the cause of another, to help someone grow, and then to defend what one believes in. And nurses are expected to advocate for patients, especially when they're unable to advocate for themselves. But how do we advocate for ourselves as a profession? In other words, how do we advocate for nurses? So we've always understood that advocacy has been a historical part of our foundation, starting with Florence Nightingale, who had to do quite a bit of advocacy. But the question becomes, what happened? Why are we not advocating for ourselves? Well, one of the major reasons that we're not advocating for ourselves is because it's quite complicated. Even though we had that simple definition of what it is, it's also been defined as being loyal to physicians, being loyal to hospitals. But that doesn't really include being loyal to the profession of nursing at some points. So nursing schools and institutions, we don't really do such a great job in preparing our students to serve as advocates. Our nursing profession has sent mixed signals about the value of advocacy, particularly from the BRN. And there's not a lot of research in terms of what nursing advocacy should really look like. So we're kind of stumped as to we know what it is, but I'm not sure that we know how to use it. So let's look at a case that really speaks to when advocacy really kind of was brought to the attention of the nursing profession. So in a hospital in Manila, in the Philippines, a physician ordered a new graduate nurse, Lorenza Samara, to administer cocaine injections instead of procaine injections to a tonsillectomy patient. So the nurse, Samara, loyally carried out the physician's order, which ultimately resulted in the death of the patient. So now it's clear that this was the physician's error. The physician ordered the wrong medication, but he was acquitted of all charges, which is kind of often what the case is. And the nurse, of course, was found guilty of manslaughter for failing to question the orders of the physician. So the whole mindset of being loyal to the physician has somewhat changed because of cases like this. So we are now taught to question the physician because we are ultimately responsible for our own practice. So it's kind of this shaky line that we've drawn. We say follow the doctor's order, but we also say advocate for the patients. So this type of case has pushed nursing toward independent practice and accountability. So moving away from loyalty to physicians to advocate for our patients is the main concept of advocacy. But there again, that leaves out that position of advocating for the profession. So now your text presents some philosophical models of nursing advocacy. And when we think about a philosophical context, this is really some of the underpinning of what really helps define a concept. So as we talked about what the definition of advocacy is, your text offers these underpinnings of what that definition could be kind of resting upon. So Gatto says that advocacy is really about this existential process, and it's the nurse's role to help patients clarify their values in the illness experience and exercise their right to self-determination. So the premise underlying this perspective is that nurses are in a unique position to advocate for patients because, of course, we spend the most time with them. So again, that is looking at the patient as well. Curtin says, well, this is all about human advocacy. So this perspective invites nurses to help patients identify meaning and purpose in their illness, with the ultimate goal of enhancing patient autonomy, again, focusing on the patient. Conk talked about functional advocacy and discussed the premise or the philosophical underpinning of advocacy as calling nurses to serve as brokers. So in other words, we're somewhat of this middleman between providing information and supporting the patient's decisions. And Conk assumed that patients were in need of advocacy so they could be freed of this sort of oppressive medical structure. Conk really felt like the medical system and medical professionals, particularly physicians, kind of make the patients more or less victims, and that it was the nurse's role to rescue them from this perspective. So now we know that we have advocacy inside of the acute care settings. And so as we think about that and think about the profession, and if we think about expanding the patient base, we understand that advocacy as a profession must be moved outside of the acute care setting and outside of the clinical settings. And the question becomes, well, why? Well, because we shouldn't limit our perspective to those things. As a profession, we have some responsibility to looking at the bigger picture. So why? Well, because there's issues in themselves that we need to look at for our profession, in the community, and in the looking at ensuring that the health of the public is going to be taken care of. And so we have to step outside of the clinical setting to make sure that we're paying attention to this perspective. So when we think about issues that impact individuals with that are maybe not quite inside of our healthcare system but have health issues that need to get in there, we have to think about making sure that there's a bridge, not only to ensure that patients that are outside the clinical setting get what they need, but to also assist in looking at issues that can impact the larger public. So in consideration of symptom management and prevention for many patients, this requires interventions that are not purely medical. So when we think about issue advocacy, it's almost always best accomplished through the formation of coalitions, and nurses are excellent at being coalition partners. We're able to bring the evidence-based expertise as well as our professional credibility to any debate. So when we think about some of the issues that are happening in mental health care, not only getting into the system, but also how do we help them integrate into the community. And this is through the provision of making sure that services and programs are coordinated and available, and that's sometimes and most often a funding issue. So these issues draw upon us looking at pictures so that we can close the loop. Looking at healthcare in our school systems, I mean, think about the number of nurses in our educational settings. They are well outnumbered by the students. And how do we really think about preventative care in those settings if there's not the services or the people that are available to provide those services? And then I know a few years ago, many adult daycare services were cut. So we should really be at the forefront in working in these issues to make sure that the public health and that patients' needs are taken care of before they necessarily come into the acute care setting, or even to prevent them from coming into the setting as well. So if we expand upon the concept of issue advocacy, we can draw that right into community and public health advocacy. We need to really advocate for social justice, and that looking at all things, considering what could be something that is going on within our communities that can impact the health of others. So we can work with these communities to mitigate these social determinants of illness and promote health. So this requires us, again, to look beyond the acute care setting. And as you can see, Longo and colleagues, they talk about in your textbook looking at this indoor air quality assessment to assist people in this particular community. So we have to be cognizant of the things that are going on within our local community. So we know that social determinants of health are complex and they're multifactorial. And we know they're pretty much almost entirely unresponsive to biomedical interventions. And so that's the core of many things that are occurring with individuals that end up in our healthcare system. So when we really want to talk about preventative health and patient-centered care, we have to think about how we can really make a difference to individuals so that maybe they don't need the acute care as much. Okay, so we already have heard that we're a powerful force, and we compose, again, the largest segment of the healthcare workforce. We are, as nurses, in the most contact with patients, and research has demonstrated that the amount and quality of nursing care that patients receive is directly related to a number of positive health outcomes. So why are we not advocating more for ourselves? Why don't we have a larger role in what's going on? So again, advocating for the profession is huge. So because nurses, we have this direct relationship, we have to advocate on behalf of the nursing profession. So we have to look at issues like workplace safety, the nurse and patient ratios, the expanded scope of practice, particularly for our advanced practice nurses, and looking at the reduction of health disparities in communities. This should be something that we've got to focus on. And it can be argued that we just simply don't have enough time, or maybe we don't have nurses that have the ability to focus on these particular issues because we're not put into these particular areas. Well, we've got to now find ways to make sure that our nurses at the BSN level have an understanding of these issues so that they can be involved in building up the profession, building up our communities, and working through issues. So just to elaborate a little bit on workplace safety, OSHA, the Occupational Safety and Health Administration, well, they report that over 2 million American workers are victims of workplace violence each year. And it's the second leading cause of death for women while at work. This is mainly attributed to homicides from assaults and other violent acts. So we have to consider that as well. Is that a mental health issue? Should we be working toward a different type of mental health care system, a different type of mental health care concern? And what about environmental exposures? I know my husband works for American Airlines, and every year he goes out and they give him a hearing test, and they tell him he can hear. I know he cannot hear. I live with him. But there is a sort of underlying political sort of perspective that would suggest that it's not a good thing to really say that people's hearing is affected from a company perspective. But if we're going to look at it from an employee perspective, we would need to advocate for those employees. There's also a large number of employees that work out there that have been cancer patients or have had some form of cancer, and it's usually lung cancer. And this is just my observation. I'm sure there's data to support that, but the airline industry is a big industry, and I'm sure that one day there will be a case against them for this. But until there is some sort of advocacy for that, then we'll be, things will kind of be status quo. But so when we're trying to create an environment that promotes subordinate advocacy, we want to invite individuals to the decision-making process in terms of collaboration. We want to listen to the staff needs, get to know them personally, take time to understand their challenges. We want to stand in their shoes for a minute just to see what it's like so that we can go to bat for them. So we want to promote shared governance. And what is shared governance? Well, shared governance is just a method of shared decision-making. It's a collectiveness that is really brought out of, just kind of bringing people who are actually doing the work at the table, to sit at the table to help make the decisions. This is about empowering staff. And then providing staff with workable systems, things that work. Nurses are great at putting things together. I mean, I can remember IV pumps breaking, and, we could use a paperclip to almost fix it. So nurses are great at that, but that's really a Band-Aid approach, and so we have to advocate for making sure that we have the proper equipment. So there's several barriers to successful advocacy. One is education and training. There's few educational programs that are designed to promote advocacy skills in nurses. And then institutional barriers, what the organization is trying to do, and there's fear of retribution, just as I mentioned with American Airlines. It's really hard for me to believe that those nurses are doing those hearing tests and are saying that all those people can hear.